And while folks are still getting on the line, I'll introduce myself. For those of you who don't know my voice just yet, this is Elizabeth Hardig, and I'm the project coordinator with the Plan4Health project. And today on our nutrition peer call, we'll be talking with the National WIC Association. If you were in New Orleans, you are probably familiar with the term Category A and Category B. We were tossing it around quite a bit there. So the National WIC Association is one of our Partnering for Health partners, and they're also a Category A, just like the American Planning Association. So National WIC is a very parallel program. They're working with 15 coalitions across the country in Cohort 2, and they had another 16 or so in Cohort 1. In New Orleans, you all had a chance to meet face-to-face with some of our National WIC partners who are launching their projects, and they're focusing on nutrition as well as clinical and community linkages for their particular focus areas. So we are excited to have National WIC with us today to talk a little bit about farmers markets and some of their overall work. And I know that a few more folks were hopping into the room while I was chattering away here. So if you are from the National WIC Association and you're on the line, if you could just let me know. All right.
Hi, Elizabeth. This is Quinny. I am on the line. And I guess we're still waiting for Crescent City WIC to join as well.
Oh, that's not a problem. Do you mind if I ask you a few questions, Quinny, about the program? Is it a way to give folks some background information?
Sure, absolutely.
So for those of you who didn't have a chance to meet Quinny face-to-face, Quinny Harris is a counterpart at WIC. She manages many of the coalitions and handles the site visits and really supports the groups as they implement their strategies. So one thing that I think is really unique about WIC when we think about Plan versus Plan4Health is that you're bringing in the clinical and community linkage, and you're really leveraging all of the great WIC clinics who are out there on the ground in the community. I wondered if you could maybe just give us a general overview of kind of the WIC's approach to your project and how things are going with Cohort 2 so far.
Sure, absolutely. So here at the National WIC Association, this project has been a really great opportunity for us, one, to really promote the assets that local WIC agencies have. So a lot of community health organizations have not necessarily engaged WIC in the past. So we really are using this as an opportunity, one, to have WIC leading coalition and leading community health projects, but promoting those assets. So one, WIC is a trusted partner in the community, working with the target population of low-income women and children. There's professionals on staff that has a nutrition expertise that we're able to pull from for this particular project. WIC has established relationship with food retailers in the community, which a number of agencies have worked around in the food retail space to get stores to be WIC approved, to be SNAP approved, and also to modify the food retail environment and the small retail stores. And then also there's the breastfeeding peer counselors on staff, and WIC also has a referral network. So for the community clinical linkages, a lot of our agencies really focus on really making the referral networks more robust and really thinking about how WIC could best add value to some of the existing initiatives in their community. As you know, the Affordable Care Act has really done a lot with health insurance and making that more available. So we did have a number of agencies that did objectives in Cohort 1 related to health insurance enrollment, working with their community partners and federally qualified health centers. We also had a number of agencies that they really, once they did their needs assessment and they really got to know their community, they realized that there was a need to do some trainings related to chronic disease prevention services, but also around cultural competence to make sure that local organizations were providing services that were culturally appropriate and sensitive to the needs of their clientele. So we had a really great success with agencies doing trainings in their community related to those two particular initiatives.
That's really helpful.
And Elizabeth, did you want me to speak about the nutrition primary A at all, or should we wait for Crescent City WIC?
Well, maybe let's give them a couple more minutes before we dive into their particular project. They might be hopping on the line. But I did want to get back to your point about training and thinking about culturally competent outreach tactics and supportive services. And I know for some of our coalitions in Cohort 2, that's and on our minds is working, working through our needs assessments and really trying to connect with vulnerable populations. That's interesting to hear. That not surprising that you're on the same page and that the WIC folks are thinking about how can they build the capacity of not only the WIC staff, but really the coalition and bringing in new stakeholders and making connections with those residents.
Yeah, and Crescent City WIC actually was one of the agencies that did cultural competence training. So hopefully they can speak a little bit more to that once they're able to join the line. But I know that in the community where they were working, Plaquemines Parish in the New Orleans area, it's a very diverse community, but there's a number of different challenges related to geographical challenges, with people being very, very, very far from some of the services and not having access to transportation, but also just a very racially diverse parish as well. So really thinking about that and using that as a strength for the work that they were doing on their project, but wanting to make sure that the providers in their community was really aware of kind of the diversity in their community and how best to serve the community with those with that specific background and demographics of the community in mind.
That's really interesting. Oh, hi, is this Mary?
Yes, this is Mary. Hi, I heard Quinny. Hi, Quinny.
Hi, Mary. I was actually just speaking about you all's references to cultural competence trainings that you all did.
Okay, good. I'm sorry I've got on the call late today. We had a visit from USDA.
Oh, nice.
And it was really good. Very good visit with USDA today.
Oh, fabulous. Great. It's an action-packed morning then.
Oh, yes, and that's why I'm sorry. They just left, and everybody got in the car, and they're heading to do their closeout conference, so everything went well.
Oh, good. Good. Well, this is Elizabeth from Plan4Health, and Connie was just giving us an overview of the National WIC Association project and a few examples of how you all have really thought about the community in terms of the strengths that folks are bringing to the table. And I wondered if maybe you could introduce your project a little bit and touch on the farmers market piece, but also this the training that you did around cultural competency.
Okay. Our farmers market program has been really successful through partnership. And our partnership is, definitely starts out with, us having our clients, the community, and definitely our local farmers, and the hard work that they put in just to grow in the crops, and then actually being able to make sure that when we have our project, which we call Meet Me at the Farmers Market, that the crop is in. And so the timing is very key for our farmers market project, because a week or two could make a difference in whether the crop is in. So we really have to coordinate with the farmer and what the local farmers do. Instead of one farmers market truly benefiting from the project, a lot of the farmers all benefit, because to stock a market properly, other farmers will come and bring their crop in. So when you watch the event, you could actually see how the farmers work together. So it's not because we actually hosted at one market. All of them benefit because that farmer who hosts will have to buy from the other farmers to properly stock the market. So what has really been a good way for our USDA vouchers to be utilized is that we have another partnership with the Audubon Institute. And we just received our coupon books, and we received a total of 90 books. The value of the books have changed from $24 to $20, so that more people could get, access to the book. So they reduced it by $4. But with the partnership through the Audubon Zoo Institute at the Meet Me at the Farmers Market, if a mom or family, a dad, which is a recipient of the WIC program, redeems their coupon book at 100% from at any point, they can get Audubon Zoo passes. We receive a donation that's probably right about right at $9,000. I think it was $8,900, which is donated, hand-delivered to our WIC office because of the partnership we have with the zoo, that at the event that we host, we have staff on board to issue the books. The books are not issued in the WIC office. They're not issued until the client will receive what's called a reservation sheet. And it's on a first-come, first-served basis. And since we get about 90 books, we will do about 125 reservations, which gives us a little room that if people are no-shows. And so with that reservation, they show up with their WIC book, and at that point, their identification, whatever they have, and they turn that reservation in, which is the reservation is pre-given out at the WIC office. It's pre-given in advance, and they bring it, and at that point, they give their reservation, do their shopping. They redeem $20. They get 4 Audubon Zoo Institute. The passes not only just is an incentive for that, but it's also the clients get a chance to have family time. So it's part of that. One of our other programs we're doing is strengthening family resilience and having families spend family time together with their children, getting a little physical activity, going to the zoo. The passes are not only for the zoo, but they can go to the aquarium, the insectarium, and the zoo passes are good till December the 31st. So because the farmers market program is ends like right at November, there's another set of crop that's coming in, and that's the fall crop, which is really good because it's your collard greens, your turnips. It's just a whole different crop. So it gives them that window to actually continue to get the zoo passes while supplies last. And what the zoo does is for every voucher that we receive, so we get 90 or 100, she gives us enough zoo passes that will equal that amount. So so that's why the value of the donation is so high, because the average ticket to get into the zoo is like $15 a person. So the families are getting about a $60 value of free zoo passes to go. It also will encourage maybe families to also enroll and get memberships. And the partnership has created very affordable memberships for our clients too. So if a family really wanted a zoo pass, we will coordinate with the Audubon Zoo, and they have come up with a value that's affordable. So it has worked. Like I said, we've done it with the Audubon Zoo passes probably for the, I would say at least 4 years when we started Meet Me at the Market. It's been good. We have a date scheduled for this year. We're scheduled for July the 9th. We will also have activities surrounding that. In addition to the zoo passes, we will do some education on site. We're going to partner with Second Harvest. Also, we have a doll called Organ Wise that was pulled into our cultural competency training because it was a doll that came in various races, and we were able to distribute. And it's really a component that deals with our childhood obesity and educating about the effects of, our internal organs and what we do and what we need to do to make sure that they stay, that we keep our bodies healthy. So we will have an organ-wise presentation going at the same time at the farmers market with education. Hold on 1 second, I'm sorry. We have a lot of events going on today, prenatal parents and education and a fatherhood class going on. But y'all can stop me at any time because I'm not sure if
That's very helpful.
I'm sorry?
That's very helpful. So it sounds like you're thinking about the farmers market not as this kind of separate special activity, but really you're integrating it into everything that you're doing. So it becomes part of the education piece that you're thinking about, part of kind of the season, all seasons, you have a component that's part of the market. And then it sounds like you're just doing a fabulous job of leveraging other opportunities. So you've got this great kind of package deal that gets at the core values of your work, as well as, our goals with this particular project in terms of increasing access to nutritious food. So it sounds like it's been a fabulous approach.
Yes, it's been really good because I think we really start getting a demand for the vouchers, which is good, because when you get someone that's,
right,
there's a supply and demand, that means that, you have to look at waiting lists and things that, the state has put in place that we can do once moms start calling. Getting 90 vouchers for us probably is a good number. We divide it between Plaquemines Parish and Jefferson Parish, our WIC sites, and So our Jefferson Parish site is bigger, so we probably could stand to use more vouchers. But what we get, we're able to get them out, and then we also encourage the moms beyond the use of the vouchers if they would continue to visit our local farmers.
Yeah.
So that's been a big plus that we can actually get that message out.
Right.
And Mary, could you speak briefly about your work with the farmer in Plaquemines Parish to get her farm stand to be SNAP approved?
Yes, basically what, and it was really good, doing our Community Partners for Healthy Mothers and Children's project was we did focus on SNAP approval and also just getting a farmer to get USDA approval. We had a farmer, Miss Patty Volk Farm. She was not, had not received the USDA vouchers for 10 years post-Katrina. And so we assisted her with that. We also assisted her with her application to get SNAP approved. So we do have a farmer, one of the farmers there is SNAP approved. Some of the problems with the SNAP approval is the equipment cost, and there is some fees that are involved. So I don't know if someone could kind of look a little more into that, because with your roadside stands, you got to take into consideration the power to actually power the machines and the equipment. In addition to, there's a fee that might be a little costly to some of the farmers. But it's really, it's been good because in the parish, a lot of our clients are recipients of the SNAP program. So in just assisting our farmers to make it more visible that if they accept SNAP, a lot of our clients didn't quite see that. So we've actually, one of the farmers called Creole Market, she accepts the SNAP voucher. So we're getting her to make, some of them will see EBT, but they understand SNAP. So it could be like a little barrier in being able to advertise it more so to our clients and being able to get that message out, probably in a WIC office. Hold on. Okay. But the SNAP component is with the WIC program. I think it definitely if as the assistance that could be given to our local farmers to actually make assisting them to get qualified, which the application is not difficult, but I think that there was some cost factor for a few of the farmers, but they were very open to accepting SNAP and always very excited to get the vouchers.
Thanks, Mary. Elizabeth, I know that you wanted to get some questions, but there was one more component that I thought was really great about the work that Mary did in Plaquemines Parish. I know that one of your coalition members who was also, I think she was the wife of a farmer, aren't they also doing a mobile farm where they're going around to different parts of the parish now?
Well, today she mobilely delivered to our WIC office today. So, yes, and she actually came in from the farm this morning. She was a little hot, little sweaty, but, we brought her in, and today she actually met USDA. She knew we were kicking off our farmers market project, so she definitely talked to the USDA staff about how they're visiting local churches, meeting senior citizens, bringing out produce and fresh vegetables out to the senior citizens in the community. But that is a campaign that they're actually working, and she visited us this morning and actually delivered some squash and some cantaloupe, and I think it was like eggplant. And definitely our Creole tomatoes, which are the crop is in right now, and it's really looking good. So today she came in and brought some. She actually came today to the office, and they're going to do for our staff too here at the office. They're going to be bringing some watermelons and some other things that are locally grown. But yes, they're doing similar to us, WIC on Wheels, but they're taking their farmers market on wheels out into the community, because Quinny can tell you just the logistics of the community, having an East Bank and a West Bank communities. The East Bank, the farmers markets are not on the East Bank. So with her farm, which is George Brooks, they're actually going to the East Bank of Plaquemines Parish and just kind of going from church to church, door to door, and actually just being able to make it more accessible for the community to get crop because of, transportation issues. They actually have to come across a ferry from the east bank of Plaquemines. The transportation is on a ferry boat.
Mm.
And so what they do is they'll load the truck up with some fresh crop and just kind of go through the community and seeing if anyone is needing it. So, yes, she was very, today, like I said, to meet the USDA, they actually really connected well with her, and that was a really, good, they could feel her passion and what her and her husband was doing to make sure that produce was able to be brought to the community.
That's really great, Mary, and that's an essential service because most of the East Bank, as I remember it, is a food desert because there's not much food retail on the East Bank. Is that correct?
Yes, that's correct. On the East Bank of Plaquemines Parish, there's more of a little stores that are close to where the ferry exits and entrance where you get on the ferry. So more or less, if you pick and get one of them has gas, the other one doesn't even have a gas station. But it's more like, hey, let me just pick up a little something because I'm going to get on a ferry ride, or if there's fishermen going down to the marina, they might pick up maybe a little, I'm gonna just be honest, it's called a hot plate, which is just some food, because they're down that way. But it's not like a full grocery store where you can actually buy anything. The families have to really come into the city to actually do their shopping. So it's a good hour drive down as far as you can go up an hour plus and an hour back up. But then they're really having to come into the city to actually do their shopping. So it's a rooted community, a lot of culture. So that's why, like, we did bring the culture competency training and sensitivity training to the community because the community has so much culture, and they're very they have a good, strong resiliency because, like I said, they've come back from disaster after disaster, but they have the natural things that they have that they can live on, and their crop, their seafood. I mean, if you don't have to do much research on it when you live here because the seafood is here, the oysters, the shrimp, and so they have a lot of natural resources that if a good focus on the community could be, to become more healthier and use a lot of those resources could make a difference. But like I said, they do come into the city and get access to all the things that we get access to, and it could, it could affect you either way, health-wise or not. But they do have a lot of natural resources down there that could make a difference in their health. Quinny can tell you there's 4 YMCAs that were built post-Katrina. So definitely the community had put in place things that would actually deal with, health and wellness for the families and being more active in their communities.
Great. Thank you, Mary. That was very interesting. I really appreciate you walking through all the different components of your project and helping us have a sense of the opportunities and the challenges that you're thinking about. I do want to give folks a chance. If you're on the line, you're welcome to ask a question or to chat a question in. We've got a few minutes left on the call. While folks are thinking about what they'd like to ask you, Mary, I was wondering if you could talk to us a bit more about the cultural competency training. Did you end up bringing in an outside speaker, or did you, how was that organized?
With the cultural competency training, it was one of the objectives that was in the grant, and we selected that particular objective for many reasons, and a lot of it was because of the culture, and one of it was because we had created what was called a tri-parish coalition. And with that coalition meant that some of our members on the coalition may not have been, comfortable with the community, and I'm not saying that they weren't comfortable with it, but just understanding the culture of the community. So we wanted our community partners to be able to go through a culture competency training, in the community. So we actually brought in a consultant who was very familiar with the community. He was with a group called the Bach group, and he was very familiar with the community. So his presentation was well received by the community. Our staff the WIC staff actually did the culture competency training with the state, but then some of our staff did come to the presentation, and they really enjoyed it. We did host it at the Plaquemines Medical Center, so there was staff from the medical center who had not had training. So we were able to bring in our coalition members, community members, staff, and to get the training, and it was well received. And I think a lot of us walked away with, just being more sensitive and understanding the culture. It is a community that is of 29% of mixed races. So it was good to be able to just have the members that were on the panel be able to speak out about how they felt. A couple of them spoke about how they felt as growing up as kids and knowing that the culture down there, even after the presentation was over, they appreciated the fact and understanding that it is different, with the mixed races and just different things that most people coming in they just want to just have a better understanding of that. So he was able to use the right angle in doing that presentation based on what he knew about the community. So I thought it was good.
Right. And what was his group again? Was it, did you say BOX, B-O-X?
Yeah, it's B-A-C-H.
Oh, B-A-C-H. Oh, BOX, I see.
BOX, Earl Benjamin was his name, is his name, Earl Benjamin is his name. And like I said, he was very familiar with the community, so he was able to, he didn't hold back. He did a lot of we did role playing, so he made it fun. We got up and did, different questions and just seeing how people, what angle they would go at, I guess, based on how they think. And so he was able to create like little pocket groups throughout the room. And if you felt a certain way about a question, you went to a certain corner. So he was able to kind of like show everybody how you really stand on issues, and then at the end be able to summarize what that particular lesson was trying to teach. So he didn't just have us sit there and just lecture. He actually did some role playing, and he did some group questions, and then broke the groups out, and then had the groups actually explain why they felt the way they did about a particular question. And it just could have been something as it was just really good questions. And it was very professionally well done, but presented in a way that made everybody eyes open. So if you didn't leave out, if you left out of that room just with one more thing that you possibly could do different, say different, or react different about it. And we all have our biases. He kind of made feel like some of us are maybe so far gone you may not be able to change, but maybe you could just change a little bit of something about the way you think about something, because you know how it might affect someone. And so today that was a topic, Quinny, that came up with the USDA when they came today, was the culture of Louisiana, and knowing that you have to, being able to get the flavor of Louisiana, all the great foods we said, but also understanding that you have to bring that flavor into in that culture into everything that you do. So we talked a little bit about, we played our breastfeeding jingles and stuff, and showed how they had the culture of Louisiana in just the music. And so it went well. So I think, doing the Community Partners for Healthy Mothers Children's Project from a WIC perspective, it now makes us, it's going to change the culture of everything. I mean, we were doing it, but we're going to really do it even more so that we can step outside of the WIC offices and then really engage the community. And then they know that we're not just here for them, but we're right alongside of them, and respecting that, everything that we do is not a handout, it's a hand up. We want to let them know that we appreciate them embracing us, because we came in from Jefferson Parish and went to Plaquemines Parish to bring WIC services that did not have WIC services for 5 years post-Katrina. So to go into a community that had to receive us, they had to receive us and see that did we fit into the culture of being able to provide service to that community. So that's the culture competency is very key in having those trainings, because it's to get into any community, whether it be Louisiana or any other state, can you fit into the culture of what you're going to do once you step out of the office, in WIC office, and just issuing vouchers. Can you step outside the doors and really know what's going on in your community? If you're from the community, you understand the community. But if you're not from a community, you need to understand, tell me something about this community. And I think the community needs assessment component of the project was good, because we went in knowing some things about the community. We knew we would find out about the health, the medical conditions, but also we learned about the culture and the demographics and and how the community was, the population was. So I think that was great. I really like that whole needs assessment component of the program too.
That's great. That's great. And I think that makes a lot of sense to come in with that sense-based approach to really get to know the community, and then to make sure that we're all doing the work of understanding the culture and the needs of the residents. Well, Mary, this has been fabulous. I really appreciate your time and your willingness to share your expertise on today of all days, when you're balancing the USDA's visit and the mobile farmer market visit too. So thank you so much. We really appreciate your time. And thank you, Quinny, for being here too and giving us the broader context of the WIC program. We really appreciate it.
You're welcome. Thanks for having us. And I did just want to do a quick plug. If anyone is interested in learning more about our project at the National WIC Association, we do have a website. It's greaterwithwic.org, so you can go on that website. And there is some information on there, some success stories, and a little bit more about our project. And actually, our cover photo is of the Louisiana Creole tomatoes that Mary mentioned that the farmers have that are currently in season down in Louisiana.
Yes.
Fabulous. Great.
And thank you so much. It's been a pleasure. Like I said, the project gave us opportunity to really spread our wings and really just spread our wings more and embrace the community in a way that just made us be a part of their home, which is Plaquemines Parish. So I appreciate that.
Wonderful. Well, thank you both so much, and we will talk to everyone soon. Have a great afternoon.
Okay, thank you.
All right, thanks.
Bye-bye.
Goodbye.
Bye.
Okay, goodbye.